Okay, we're very, after this morning's really informative and exciting series of speakers, and this item came up as we would expect, but in several times during our discussion, the importance of oral health and cancer. And as it just happens, we have Dr. Michael Margolis here to present on this very topic now. So I introduce to you Dr. Michael Margolis.
Thank you, Steve. I started out as a traditional dentist like everybody else in dentistry because biological dentistry has been under attack and certainly isn't taught in any of the dental schools. In fact, much of what we're taught is ignored when it comes to materials. I've been in private practice since 1984-85 in Mesa, Arizona, hotbed of controversy in dentistry. There were a number of biological dentists that were trying to be put out of business. And when I was rear-ended by a tow truck going 45 miles an hour in 1994, I had one root canal and got sicker than a dog. My neck went from 17.5 inches to 24 inches in 5 days. In a month, I couldn't eat anything, but I gained 25, 30 pounds. And I was in really bad shape, couldn't think straight. And had kidney stones twice. If anybody's had that pleasure, you know how painful that can be. And went through lipotrophy, and it came back a second time, and just wasn't a lot of fun. I was not a very fun person. But prior to that, I had learned that mercury wasn't exactly as safe as the American Dollar Association was claiming. Some people call it dental association, but it's all about money. And so it was a wake-up call when I lost my thyroid to a misdiagnosis of cancer. And so now today I have the pleasure of being diabetic and have a number of health problems that I went back to school at Capital University when it was still existing and started to try to figure out why my one son, who was ADD and dyslexic, could be helped and maybe find a little health myself. So over the years, I've had the pleasure of meeting Dr. Abe Burr in Arizona, homeopathic license #1. I see a lot of heads going, yeah, Abe saved my life. He figured out that my thyroid wasn't working. Bruce Shelton, who's now head of the Arizona Homeopathic Integrated Medical Association, which I sit on that board, also has helped, and it's learning how to detoxify. So my talk today is basically going to be talking about biological dentistry, and then towards the end I will be talking a little bit about cancer. But you have to have a basic knowledge of what's going on in biological dentistry in order to go ahead and see what's happening. This is our symbol, our logo. It says, "Thinking outside the mouth, my dentist." And if you ever have a question, you could go to doc, my dentist, at mydentistaz.com. That's my personal email, doc@mydentistaz.com. And I don't know if we included this in here, but 602-363-9584 is my cell number. Whenever I'm going to be working on a patient that's going to have surgery, they get that number. It's our after-hour emergency number, and I give it out to everybody. And I say, text me. It's easier than calling because I rarely can talk when people call. 602-363-9584. And I found out I was very, very lucky being in Arizona because we have a naturopathic school there, a few graduates here. And we also have the MDH degree that's handed out. So I have a lot of referrals coming into my practice. So what is holistic dentistry? Biological dentistry or alternative dentistry? We stress the use of non-toxic restorative materials for dental work and focus on the impact that dental toxins and the hidden dental infections can have on a patient's entire health. We treat the teeth, jaws, and the throat, the autonomic nervous system. I would venture to tell you that right here is the center of life for your entire body. If you can't swallow and you can't breathe, what are you? Dead. Dentists don't understand that connection. And one of the sad things that I see are crowns that are put in that are over-contoured, causing the tongue to choke the patient, and other problems with dentures and partials. They're made so they slide. They don't support the tongue up and over, but they push the tongue back into the throat. So what we were taught to do in clinic actually hurts our patients. And then again, we'll be talking a little bit about biocompatible things. So the problems that a biological dentist is going to look at is toxicity from dental materials. Is it possible to turn some of the lights down too, please? Because later on, I understand, but later on when I go in there and show some stuff, you're not going to see it. So toxicity from the dental materials, biocompatibility. There are two tests out on the market, Biocomp and Clifford testing, and they will tell you if your blood is compatible, if there's an antigen effect when they test the materials. And I've been using that since 1994. Electrogalvanism and ion migration we're going to talk about. Root canals is a cause of illness. Hidden bone disease, infections of the jawbone. Relationship between specific teeth and illnesses. TMJ, temporomandibular joint, is not a disease. It's a structure. How many people suffer from elbows and shoulders and knees and hips? Okay? TMJ is the same thing. Neuromuscular body balance. Sleep disorder. My God, how many people have patients that when you look in your eyes, you see like they're exhausted. They don't have any sleep. That's a major, major problem today. And balancing this spot here for the autonomic nervous system. So we're trying to solve, go back. We're trying to solve a mystery here.
This is the city. Los Angeles, California. Some people rob for pleasure. Some rob because it's there. You never know. My name's Friday. I'm a cop. I was working the day watch out of robbery when I got a call from the Acme School Bell Company. There'd been a robbery.
There's been a robbery.
Yes, sir? What was it?
My clappers.
Your clappers.
Yeah, you know those things inside the bell that makes them clang?
The clangers.
That's right, we call them clappers in the business.
A clapper caper.
What's that?
Nothing, sir. Now, can I have the facts? What kind of clappers were stolen on this caper?
They were copper clappers.
And where were they kept?
In the closet.
Uh-huh. You have any ideas who might have taken the copper clappers from the closet?
Well, just one. I fired a man. He swore he'd get even.
What was his name?
Claude Cooper.
You think he...
That's right. I think Claude Cooper copped my copper clappers. Kept in the closet.
You know where this Claude Cooper is from?
Yeah. Cleveland.
That figures. That figures.
What makes it worse, they were clean.
Clean copper clappers.
That's right.
Why do you think Cleveland's Claude Cooper would cop your clean copper clappers kept in your closet?
Only one reason.
What's that?
He's a kleptomaniac.
Who first discovered the copper clappers were copped?
My cleaning woman. Clara Clifford.
That figures. Now let me see if I got the facts straight here. Cleaning woman Clara Clifford discovered your clean copper clappers kept in a closet were copped by Claude Cooper, the kleptomaniac from Cleveland. Now, is that about it?
One other thing.
What's that?
If I ever catch kleptomaniac Claude Cooper from Cleveland who copped my clean copper clappers from kept in the closet,
Yes?
I'll clobber him.
I actually love that thing. It is so good to get people going and awake and back from a break. So solving the mystery behind your source of disease, could the key be in your mouth? Here's the truth of the matter. You have the enamel on the outside. You've got the dentin that's composed of dentinal tubules, about 3.5 miles in a front tooth, possibly up to 5 to 6 miles in a back tooth. That's filled with protein. Here's your pulp, or the heart of the tooth that your blood, nerve, and lymphatics go through. Out on the outside is cementum. It's a little less hard than enamel, but that's the surface where the periodontal membrane or ligament attaches to the bone, and then this is where the food comes in and out. We'll be going into that a little more. The periodontal ligament, perio is around down to his tooth, and the ligament holds bone to bone. So the purpose of the periodontal ligament is to hold the tooth to the jawbone. If everybody just tries this, what do you feel? Any pain? No, you don't feel pain, you feel the pressure, because the periodontal ligament is like a sling that the tooth goes up and down in. And that gives you your perception. If you meet people who have full dentures, some of them don't get good balance right off the bat because they don't have that proprioception in their mouth. And the third one, which is the killer, prevents bone growth. All ligaments prevent bone growth, or we'd be stiff as a board. So the problem here is if you take the tooth out and leave the periodontal ligament, the brain thinks the tooth is still there. What dental procedures can affect the health of the periodontal ligament? Anything a dentist does. From restorative, from fillings, crown and bridge, extractions, root canals, orthodontics. You're taking the teeth and you're moving them. And you got to lay down bone and dissolve bone and create more bone. Periodontics is just the treatment of the bone and the periodontal ligaments. And oral surgery. What are the materials being placed? Are they being handled properly? I saw a doctor I went to visit once. He put some white filling material in, he took the light, went boom, and then he was done. That didn't set the material properly. It has to be a minimum of 20 seconds, and you can stack it in different increments to build it up, because if it's an inch long or if it's real far in there, a few millimeters, the light's not going to penetrate. So you have to do it in increments. Has the doctor tested the patient for biocompatibility? I talked to other dentists about this. They go, what? Isn't that stuff good? I said, no, it's got plain aluminum in it. That's carcinogenic. Nickel, that's carcinogenic. Gee, what other things are we using? There's a lot of things in dentistry that aren't safe. Are the procedures being performed correctly? When you take out a tooth, you got to remove the periodontal ligament. And what type of anesthesia? This is really important. Tell all your patients they're allergic to epinephrine. Epinephrine causes the anesthetic to last longer. The problem is you're going to traumatize this tooth now. You're going to cut on it, you're going to do something to it, and it's holding its breath. How would you like to race somebody a 100-yard dash and hold your breath the entire time? It's not very healthy for you. So you don't want epinephrine ever used. And some dentists will look at me, well, gee, I got to have the anesthetic last. The anesthesia will last up to 2 to 3 hours, and if you need more, give them another injection. So let's take a look at extractions and root canal therapy. When a tooth is extracted, the periodontal ligament is ripped in half. Some remains in the periodontal, socket. The other part comes out with the tooth. The remaining periodontal ligament within the socket prevents bone growth, creating an environment for bacteria, protozoans, and viruses to live, and heavy metals and pesticides to settle. To prevent infection or toxic conditions from developing, the biological dentist will remove 1 to 2 millimeters of bone, which removes the periodontal ligament in turn. You get better healing, less traumatic pain, prevents dry sockets, unless a patient is dumb enough to go ahead and drink out of a straw or smoke, and decrease the possibility of developing ischemic, lack of oxygen, osteo is bone, and necrosis is dead. The tooth is a living organ. They have many purposes, from speech, chewing, and fighting, believe it or not. Blood, nerves, and lymphatics run through the teeth. Dr. Steinman of Loma Linda University developed a dye that was small enough to fit in 30 microns and flow through. And he found that the blood and lymphatic fluids flew through the canals, the pulpal structures, all through the dental tubules, bathing the inner part of the tooth, and then going out through the periodontal ligament into the bone, and fed the protein within the dentinal tubules. Here's a tooth picture. You can see all the structures we've already mentioned. And a root canal therapy is performed when the nerve is dead. It's been exposed by trauma, carious lesion, cavity, or unexplained death. Sometimes you just don't know why. Blood vessels, lymphatics, and nerves to the organ are removed, and a filling material is placed inside the canals to seal it tight so it stays sterile, according to root canal therapists. Consequently, the protein that existed in dental tubules prior to the start of the root canal will decompose, and the toxins are forced into the periodontal ligament. So prior to the root canal being performed, you have 3.5 miles of dental tubules in its root structures filled with amino acids and proteins. Dental tubules are 30 microns in diameter. Temperature is about 100 degrees, and it's very moist. So let's think about this. If you take a piece of meat and put it outside in the dark, where it's moist and 100 degrees, and just leave it there, how many of you would like to have that for dinner tonight? I don't think so. This tooth is sitting in your body for years. So access is made through the top to the center of the tooth, the pulp, and it's shaped so a liquid, paste, and gutta percha, which is a rubbery substance, can be placed to seal the tooth. The results of a root canal treatment is the tooth is dead. There's no hydrostatic pressure pushing out now. So the bacterium and protozoans, viruses, can enter the dental tubules, feeding on the dying necrotic protein left behind. Basically, they're having an orgy, they're having a great time. The treatment has destroyed the natural pathways for the tooth to be nourished, and the waste disposal pathways no longer exist. Therefore, the necrotic debris oozes into the periodontal ligament. The canal is filled now. The protein that was in the dental tubules is trapped, so no nutrition can enter the tooth, nor can the waste disposal pathways be properly disposed. In my opinion, and it's only my opinion, so it doesn't mean a lot, all root canals are time bombs waiting to explode. Okay? So depending on the location of the tooth and different health problems may occur, you have meridians, the tooth meridian and the body meridian together. Treatment for a root canal, in my opinion, extraction of the tooth and complete debridement of the tooth socket and surrounding bone. So I must note here, there are some holistic and biological dentists today that believe a root canal treated with ozone therapy and either biocalyx or endocal, which depends on when you bought the stuff, are safe for people. I totally and completely disagree with that statement. If the tooth has no pressure pushing out, the ozone cannot clean out every one of those tubules. And when you have pressure pushing in, as I said before, the periodontal ligament acts as a sling. So even though there may be a root canal in there, when you put it in there, there's a negative pressure pulling up into those dental tubules. And the bacteria will go in there and start eating away. And even if there was nothing in there, it's still a haven for them, and it will take about 18 months for that to become toxic. Boyd Haley, who used to be chairman at the University of Kentucky, did a study on this. They tried doing a study with biocalyx, which later became endocal. And he found that after 18 months, the tooth was just as toxic as a traditionally done root canal. So treatment. You can do nothing. You always have to tell a patient you can do nothing. We use a cavitat, which is an ultrasonic imaging machine. I've tried homeopathic remedies and I've done ozone therapy, but I found out that I can do all these things, but the only thing that, in my opinion, works is surgical excision of the affected area, ischemic osteonecrotic bone, or the extraction of a tooth. This is what it kind of looks like. I want to thank Jerry Boco. He used to be a head of oral pathology at the University of West Virginia for 17 years, and then the last 8 years he was at the University of Texas at Houston. Like inflammation, it's not so much a disease in its own right as it is a generic process. This is a site of a past extraction of a tooth or a number of teeth. Jerry presented this in Houston, and the person who had this jaw committed suicide. He put a gun in his head and blew his head off. The pain was excruciating, and nobody could help him. The woman, his wife, came into the room while he presented that, and he saw her in the back. If anybody here knows Jerry Boco, he's the most sensitive, wonderful person in the world, and he starts presenting this. She came up to him afterwards and gave him a hug and a kiss. He says, now I understand why my husband did what he did. Because if you've ever known anybody that's committed suicide, it is a very traumatic experience for those who are behind, especially the family and friends. So this is what it looks like. It's kind of icky, tarry, and just comes out. It's a local reaction to a variety of systemic and local factors triggering events that reduce nutrition and blood flow to the bone marrow. This is why I say do not use anesthetic with epinephrine, a vasoconstrictor. It can cause this condition. Come on, keep going. It may be abrupt or very gradual. And Jerry Bocaux called it neuralgia, ischemic, chronic, or cavitational osteonecrosis, or NICO. If the pain is of the face or the head, it's generally referred to as an osteonecrotic lesion. If the pain, if it's not of the face but joints and muscles, he usually refers to it as myelitis. Now those aren't always held true, but it's close. This may appear as arthritis, fibromyalgia, chronic fatigue, or many different degenerative diseases or unexplained diseases, like cancer. The ends of the long bones are most susceptible where the blood is furthest from the heart, and you can go through and measure these things. And in the jawbone, it occurs in the corner of the ramus down here or up in the third molar area on the top there. Jerry came through and came up with the ischemic bone diseases, has 72 diagnostic names, and when he found this in the jawbone, he took it to his mentors at Mayo Clinic in Minnesota, and he gave them the slides. And they said, what is this? They said, oh, that's definitely the hip. He says, no, that's of the jawbone. They said, no, that can't happen. It doesn't happen in the jaw. He had hundreds of samples to show them. They changed their mind. Diagnosing a patient can be difficult. You can do nothing. You can investigate it with the cavitat, along with a 3D cone beam radiograph, which we're going to show you in a few moments. Homeopathic remedies, ozone, hyperbarometric oxygen is great for patients, but the surgical excision is what I depend on for my patients. So I'm going to show you a 3D cone beam product here. We have this in my office. I had a case that I had a patient complain to the board about me. It was very, very interesting because she canceled her appointment 10 minutes to 5 the night before, so we charged her $100 an hour for what she didn't show up. That cost me about $120,000 in attorney fees because she said I overdiagnosed her. There was a specialist, a gum specialist, that backed her up on 4 bite wing x-rays that shows just the crown of the teeth. The guy didn't know what ischemic osteonecrosis was. I wanted to go after him, sue him, and it turned out that my attorney told me I wasn't allowed to do that, and now she's my wife, so she wins. But I have fulfilled my dream. I do sleep with my attorney. Confessions, true confessions. This is a 3D cone beam. Here's a root canal. This gentleman came in just Wednesday, so I met him 3 days ago. He has metal restorations, and he's got an awful, awful root canal here. And this is adjustable. You can see right here, let's make that a little bigger so you can see that. Let's go there. You can see the infection right here, right where the arrow is. It's not too hard to imagine that. And when we go back a little further, I'm sorry if my head's in the way, you can just cut it off, it's okay. We just come over here and we can show you an area of the bone right in there that it's not very dense. Back here shows, I don't know if you can see that, shows the empty spot. So it's 3-dimensional. And I got all 3 planes that I can go through. But what's interesting is he's got prostate cancer. So the thing that is interesting is when we look at the front teeth, which you're going to see correlated in just a moment when we go through the tooth chart, he's got, that's the wrong tooth, let's go over here. He's got a problem. Oh, I got a problem aiming this thing, that's my problem. But let's get this off here and see where we are. There it is. When we go to this tooth and we hone in on it, come on guys, I had this out so well earlier. There it is. Right there is the infection in that spot. Come back this way. We have a little spot of infection there, and when I take this off, let's blow this up a little. You can see right around the root tip here is the infection. So he doesn't have a root canal yet. That's what his doctor recommended that he get. Now he's got prostate cancer. So if they go in there and do a root canal, that's not going to clean the infectious area outside the root of the tooth. It's just a pocket of unbelievable stuff. And today we are taking samples and having them evaluated by DNA. I used to take these things and send them to a lab, and they came back and said, well, there's staph and strep. Who cares if there's staph or strep in there? I want to know what's causing the disease, and I'll show you that in a little bit. So this has got a whole bunch of stuff going on in this man's mouth. We can also go look at a few other things in this x-ray. We can look at his throat and see how his breathing is. Let's see if we can get this back to where it belongs. There we go. So we make the skull look forward, and we can come in, and we can look for a lot of different things. You can see the airway here. Neck is kind of straight. The hyoid bone is down here, but the tongue needs to come all the way up to the top of his palate. If it doesn't, then we generally will find some problems with sleep. And he has to sleep on his side. He can't sleep on his back anymore, or he chokes. So we're going to go back to, if I can see this in the dark, there we go. Okay, we'll go back to the other images. But that's a 3D. Reason I bought that machine, which is $175,000, was because the state board told me I didn't have effective radiography. This, I can go through and slice it. And then they didn't understand this. This is quantitative ultrasonic. It's a Cavitat. The company, unfortunately, is no longer in business because Bob was getting lawsuits from all over California by a guy by the name of Wisdig, may he burn in hell, an attorney, our favorite profession. Where's Tom? Tom's also an attorney. Yeah, okay. Great guy. Oh, by the way, this is a little off the topic, but has everybody read Tom's book? Because if you haven't read his book, he apologized for saying, buy my book. He shouldn't apologize. It is one of the best books I've ever read on vitamin C, and I'm only a dentist. And if you haven't taken his products, they have really turned me around greatly. So that's just a plug-in. That's my criticism of Tom. He's an attorney. But other than that, he's a great guy. Okay, the ultrasound goes through, and it creates an image by putting sound waves through the bone. Bone has a different density than does tooth and soft tissue. And this goes through, and it measures how dense something is. Bob Jones is the inventor. Jerry Bocoe did the rating. This went to the FDA. They presented this with two different groups. I was in the control group. In the control group, we did 1,300 different images. I did 256 or something like that out of the 1,300. There are 5 other guys or 6 other guys that contributed. And we found out it was only about 99.6% accurate. So, you know, and that was by testing it with Jerry Bocoe doing the biopsies. But I did something a little different. I did toxicity reports with Boyd Haley when he owned ALT, Affinity Technical Laboratories. And they were able to see how toxic something was in the Krebs cycle. That was sold, and then the company turned out to be a company that did endodontic supplies. So they wanted to get it off the market. And so unfortunately, when I spoke to Tom, or not to Tom, but to Boyd afterwards, I asked him, didn't you have a performance clause? And he said, my attorney didn't recommend that. Because if you have a performance clause and something isn't done in 18 months, all the patents go back to you. And that didn't happen. Anyway, the Cavitat, when you have something like that that's all green, it only measures the top, and that's very, very healthy. There's no visible alterations of the x-rays. This is a 1 and 2. This is commonly seen all over the place, and that's very, very healthy. And mild radiolucencies, poor demarcation. So it's something that you can look at. But here, when you start seeing this break down like this gets serious. This means that the bone isn't healthy, that it's not getting any circulation into it, and that it's just crud in there. And then This is the schematic of it. You have fistulas going out. You have the main body of toxins and broken down soup, crystallized bone. And so this is a ultrasonic imaging of the whole mouth. And tooth number 29, the lower right second premolar, here's an x-ray. And this is all broken down here. But in this area there, what you'll see is that there's no bone density in there. And when you open it up, we're going to show you one of those cases. It's pretty crummy. An infection in one part of the body affects another part, focal infection theory. Traditional dentistry and medicine actually confirm this statement. When a patient has a heart condition, kidney problem, artificial joints, or other conditions, the bacteria in your mouth may hurt you. What do? Premedicate you. Gee, I usually premedicate with Pleonot and Art A, but that's a Sonum product. Focal infection theory is the source of infection may become a health interruption in different parts of the body. Materials in our mouth may affect the lining of the gastrointestinal tract, muscles, joints, and other parts of the body. We also have the remaining periodontal ligament can cause serious problems, and impacted wisdom teeth is a very, very serious problem many times with people with blood pressure and heart conditions. Depending upon the location of the bone lesion or tooth within the mouth, the impact on different parts of our body may result. If you want to get this next thing, Dory at Meridian Tooth Charts, there are numbers here. You can get what I have, or you can go to my website and use it for free. But, and that's mydentistaz.com. You can click on Tooth Meridian Chart, and it will take you to a tooth, and you could click on any one of these, and that tooth will come up. So basically, you have 5 meridians: the urogenital, liver, gallbladder, large intestine, lungs, stomach, thyroid, heart, and small intestine. And basically, the urogenital affects the ovaries or testes, depending on the model, your bladder, and your adrenal glands. I'll tell you right off the bat that if you look at the laterals, not the central teeth, but the laterals, 7, 10, 23, and 26, that person will come down with chronic fatigue and fibromyalgia, usually in that order. It just happens over and over. It just takes time. Now, on this chart, I'm going to go through one tooth in each one of those areas because we'd be here all day, and I want to make sure we get out on time. But it will tell you the organs that it affects, and the spine, the gland it affects, the sinuses, sensory organ, your musculature, and foot, sacral, coccyx in this area, and then other relationships. When you get to the third molars, you can't list all the relationships that it has in the body. But it will go to each and every one of these teeth, and you can get an idea of what it's going to affect. Your canine teeth, or your eye teeth, affect your liver and gallbladder. They're your major detox. It's also your major joints, so the lower part of the body. I have a son who was competing in Taekwondo world competition, and he pulled a groin muscle. So I took some Polocaine and did some injections around the canine on the lower, and he took his foot from here to over his head with no pain in about 10 seconds. So he was able to compete. And he just couldn't believe it. He was waiting for it not to work because he was hesitant on some stuff. But he did pretty well. Anyway, the whole thing is it affects your heart, gallbladder and liver, trunk, foot, hip, and knee, and of course, your eyes. That's why they're your eye teeth. And then you just go through prothrombin time. You can look for diabetes in some of this because it's right next to where diabetes is, and the charts. And how we go to the upper premolars and lower molars, large intestine, lungs, and thymus. T-cell production might be a little important for cancer. And then you can start taking a look at all the organs that this affects. Thyroid and thymus, your spine connection. I know there's at least one chiropractor out here that was here earlier. And then your trunk, extremities, foot, controls gall, meridian, liver, gallbladder, goes through all those different connections. And then there's your pancreas. So if you have a diabetic and they have root canals on your upper premolars, think that root canal could be causing some problems. And then, of course, your digestion and your lungs for the lower. This is how I got involved in it. because of tooth number 3, I had a root canal, and that's what went crazy after my car accident. I couldn't eat anything without having gas, so that affects your stomach, digestion. Thyroid, it wasn't working. Kidney stones twice. The only thing I didn't get, thank God, was mammillary gland or breast cancer. Whenever I see a woman who has root canals on any one of these 8 teeth, I sit down with them and talk to them, and I say, look, do you have more lumps and bumps on the side where that root canal is? 95 to 98% of the time, it's that side. Of course, last month I had a woman who had breast cancer on the left and the root canal was on the right. But normally speaking, I only find 1, maybe 2 people like that. All the rest are always on that side. So when you look at it, it's your pancreas, your stomach, your breast, your bladder, and it's your adrenal glands, and so mammillary glands. It also, one of the things that you want to look at very bottom is communication, family relationships. You find that it does have an effect on people and partnership. After I had that, it wasn't much longer after that I did go through a divorce. And I think that it was part of that was part of the situation. So you have some of these problems here, and you can take a look at that. Then we go to our wonderful third molars, or our wisdom teeth. How smart really are they is what I want to know. Because how many people here had your third molars taken out, wisdom teeth taken out? On my lower right, I had that taken out when I was in college, and my blood pressure was a measly 215 over 160, and I was feeling pretty crummy, so I went up to see a friend of mine, Wes Shanklin, up in Ohio, and he went in, he took my blood pressure, he says, I can't do anything on you today, it's way too high. I said, you got a choice, I won't take the rat poisoning they want me to take, so I want you, just go ahead and do it, just don't use any epinephrine. He opened it up, cleaned it out. The next morning, my blood pressure was 140 over 80. Now, I don't know about anybody else in this room, but I could live with 140 over 80. It's lower now, unless I get a physical, then it jumps up. Drives me crazy. But anyway, it also affects the duodenum jejunum. That's not too important, is it, if you want to ingest any of your food? So you have your heart, duodenum, and then, as I said, you can go through all these conditions, and it is amazing what your third molars will affect, inner ear, sinuses. So it does go through a tremendous amount of different effects on the body, your wisdom teeth. So we'll go from there. So at this point, we're going to go into clinical correlation, biological dentistry, and reality. And what matters most is how you actually see yourself. Where do you see yourself in this? Are you the kitty cat or the lion? Here's a removal of mercury fillings and all metal restorations. Step number 1, when people come into the office and they're sick, we make sure their gums are good. I don't know, how many of you are in hospital settings instead of private practice? Okay? How many hospitals take care of people's oral health when they're in the hospital? How many go in there and actually check to make sure that they have their teeth brushed and cleaned? You're not looking at me. Okay. We had a patient, and this is a little soon in the presentation. Michael came in. His right lung was full of cancer, had a brain tumor. He went through all the traditional stuff, and they said, go home and die. There was nothing that touched it. His brother, a pediatrician in the U.S. Air Force, retired, went holistic because he was in the Orient, married an Asian woman, and started seeing how she was treating people and tried to bring it into the base, which was a little crazy. And then he got into holistic, and his brother came to him and says, well, they said I'm going to die. First thing he did was bring him to my office. We went through and cleaned everything up. We first cleaned up the gums, took out all the metals, then removed the root canals and cavitations, the holes in the jawbone. The problem was they detoxed him too quickly. This is something that I don't know enough about. He had a stroke. The man dropped out of MIT because he was making 6 figures and couldn't maintain school and the job at the same time. Absolutely brilliant. His mind works, but the body's not working. It's devastating. Speed is also very important to know how to do that, and I don't have the answer for that. I learned about it 2 weeks or 3 weeks afterwards what you had to do, and his brother found out after his brother had the stroke. We remove using a rubber dam, and we have separate oxygen to the patient. Some of my patients I actually cover up, so all you see is this much of the face. They're just totally covered, because any spray or anything I don't want getting on them. And then we remove the mercury filling. We have filters going in the room. And then we clean it up. You'll see a little stain in here. Stain is not dangerous, but take the stain out can be, and then we put a composite resin in that tooth later. The use of amalgam is contraindicated. 1, in interproximal or occlusal contact to dissimilar metal restorations, or galvanism. In patients with severe renal deficiencies. In patients with known allergies. Anybody allergic to cyanide in this room? Or lead? For retrograde or endodontic fillings. I had a woman come in, Susan. She only had 9 teeth left. I told her to quit getting root canals 5 years before. She disappeared, came back, had 9 teeth left, had those all root canaled, those were pulled, they all failed. Then she shows up to me, she can't remember anything. She's just amazing. And she looks at me, she says, I gotta get this mercury out of my head. And we took pictures and we couldn't find anything, so she convinced me to go in to her jawbone and explore. And it was the most horrendous thing I've ever done in my entire life. I pray God I never have to do it again. 7 different surgeries. And we went in and we always found mercury somewhere. Didn't show up on x-rays or anything else. She came in just a little while ago and she looked at me and she says, give me a phone number. So I gave her the office number. Give me another number. So she told me that number and went back and told me the office number. She said, give me some other numbers. So I gave her my home number, my cell number, my wife's cell number, everybody else. She kept repeating every one and went back to the very first one. This woman was brilliant. Once we got the mercury out of her system, she was brilliant again. So as a filling material for cast crowns. So in other words, if you have a gold crown, you don't put it over a mercury filling. In children under 6, people developing their neurological, I figure if I can't give it to a child, why would I want to give it to an adult or an expectant mothers? Those are the warning things on Dispersaloid, the largest maker of mercury fillings. But you know what's crazy? Is you see it all the time with these people, that they have all these different things going and they totally disregard the MSDS. So what we're going to try to do here is show you what mercury does. Let's see if I can get this right. I think this is it. Yes. Thank you, Paul. Do we need the microphone for this?
All mercury silver fillings leak substantial amounts of mercury constantly. The amount increases with any kind of stimulation, and as a result, mercury from fillings produces the majority of human exposure to mercury. The International Academy of Oral Medicine and Toxicology is extremely concerned about the anecdotal claims of safety by manufacturers and dental trade associations. They're at variance with the published peer-reviewed scientific evidence to the contrary. The precautionary principle requires action once the possibility of harm exists. It does not require proof beyond a shadow of a doubt that in the case of heavy metal and xenobiotic exposure is both nearly impossible and unnecessary, in our opinion. What you're seeing is mercury vapor coming off a 25-year-old silver amalgam filling in an extracted tooth. The background is a phosphorescent screen. The mercury vapor absorbs the fluorescent light, and you can see it as a shadow on the screen. This is mercury coming off a filling that was dipped in water that's the same temperature as the human body. This is a filling that was rubbed with a pencil eraser for just a few seconds. Like going to the hygienist and having her clean your teeth. These are not small amounts of mercury. If you can see it, it's more than 1,000 times higher than the Environmental Protection Agency will allow for the air that we breathe. What about the last time you went to the dentist?
It gives you an idea of what mercury is. Let's see if we can stop this. Okay, there's a place to stop it, I know. There we go. Let's get back to our presentation. Okay, let's go here, current slide. This is what mercury does to the cells in your body. Okay.
How mercury causes brain neuron degeneration. Mercury has long been known to be a potent neurotoxic substance, whether it is inhaled or consumed in the diet as a food contaminant. Over the past 15 years, medical research laboratories have established that dental amalgam tooth fillings are a major contributor to mercury body burden. In 1997, a team of research scientists demonstrated that mercury vapor inhalation by animals produced a molecular lesion in brain protein metabolism, which was similar to a lesion seen in 80% of Alzheimer's diseased brains. Recently completed experiments by scientists at the University of Calgary's Faculty of Medicine now reveal, with direct visual evidence from brain neuron tissue cultures, how mercury ions actually alter the cell membrane structure of developing neurons. To better understand mercury's effect on the brain, let us first illustrate what brain neurons look like and how they grow. In this animation, we see 3 brain neurons growing in a tissue culture, each with a central cell body and numerous neurite processes. At the end of each neurite is a growth cone where structural proteins are assembled to form the cell membrane. 2 principal proteins involved in growth cone function are actin, which is responsible for the pulsating motion seen here, and tubulin, a major structural component of the neurite membrane. During normal cell growth, tubulin molecules link together end to end to form microtubules, which surround neurofibrils, another structural protein component of the neuronal axon. Shown here is the neurite of a live neuron isolated from snail brain tissue, displaying linear growth due to growth cone activity. It is important to note that growth cones in all animal species, ranging from snails to humans, have identical structural and behavioral characteristics and use proteins of virtually identical composition. In this experiment, neurons also isolated from snail brain tissue were grown in culture for several days, after which very low concentrations of mercury were added to the culture medium for 20 minutes. Over the next 30 minutes, the neurite membrane underwent rapid degeneration, leaving behind the denuded neurofibrils seen here. In contrast, other heavy metals added at this same concentration, such as aluminum, lead, cadmium, and manganese, did not produce this effect. To understand how mercury causes this degeneration, let us return to our illustration. As mentioned before, tubulin proteins link together during normal cell growth to form the microtubules which support the neurite structure. When mercury ions are introduced into the culture medium, they infiltrate the cell and bind themselves to newly synthesized tubulin molecules. More specifically, the mercury ions attach themselves to the binding site reserved for guanosine triphosphate, or GTP, on the beta subunit of the affected tubulin molecules. Since bound GTP normally provides the energy which allows tubulin molecules to attach to one another, mercury ions bound to these sites prevent tubulin proteins from linking together. Consequently, the neurite's microtubules begin to disassemble into free tubulin molecules, leaving the neurite stripped of its supporting structure. Ultimately, both the developing neurite and its growth cone collapse, and some denuded neurofibrils form aggregates or tangles, as depicted here. Shown here is a neurite growth cone stained specifically for tubulin and actin, before and after mercury exposure. Note that the mercury has caused disintegration of tubulin microtubule structure. These new findings reveal important visual evidence as to how mercury causes neurodegeneration. More importantly, this study provides the first direct evidence that low-level mercury exposure is indeed a precipitating factor that can initiate this neurodegenerative process within the brain.
Can we say MS? Or other problems that we see neurologically? Impact of galvanic, I'll spit it out, charges. A gold filling placed immediately next to a silver amalgam filling can cause sharp pain. The interaction between the metals and saliva causes an electric current to occur. This is from WebMed, and in another statement by a governmental policy, it said it's rare. Look, if the physics and science are constant, you know you're going to have that effect. The mouth is full of saliva, salts, enzymes, components of our immune system. All these components and metal restoration materials react to create galvanic charges. You get people who have partials that are metal, placed on crowns that are a different metal, which are sometimes placed on titanium implants. And all you're creating is a huge, huge battery. Excuse me. This will depress the person's ability to protect themselves, depresses their immune system. Thanks to Steve Evans, he gave us these 3 slides. Here are 3 gold crowns. When you cut them and split them in half to take them off, what you reveal is you're going to see decay and other deposits on the teeth. You got to clean those out. They decay because the galvanic charge eats away the cement that is used and allows bacteria to have a feast. So I'm going to show 2 real surgeries that we've done and explain what they're about. This gentleman was referred to me by Steve Swidler, another dentist in Tucson. We took out this implant, which was titanium. He had hip problems. But what we're going to talk about is actually this tooth over here, and I'll show you why. We did a cavitat study, and the 3rd molar over here shows that it's not good, and there's a problem around this tooth. In this up-to-date x-ray, what you'll see is it's now missing its crown and the abscess between the roots. And here's the cavitat. Cavitat correlates from here to this spot over here where there's a shadow, and here and over there to where the tooth is. And so what we did was we classified them, and then we started to do a surgery on this site. So this is what it looked like before we got started. After the person is totally numb, there's the broken tooth without the crown. I went in and I peeled back or released the flap over 19 on the outside. You want to be careful of a tooth, a structure of the jaw called the mental foramen, where the nerve goes to innervate your lip and your lower chin. If that's cut, then you're a pretty sloppy kisser, so you don't want that to happen. And so when you extract this tooth, which we did here, the work just begins. We place it in for a biopsy. So the abscess is present here, this little red area there, and so we start working the abscess out. We want to get down to white angelical bone. We want that bone to be a beautiful white. And as you can see, we're taking out goop, GOP, abscess tissue, which is a lot of fatty tissue, probably some cholesterol mixed in there with whatever it's got. And then out here is the 3rd molar. If you notice, the jaw goes like this and the 3rd molar is out here. That's because the human jaw moves out to the side. Doesn't go back into the throat, but comes out. And the biggest problem I have teaching other dentists how to do this surgery is to tell them that they have to go outside towards the cheek and expose that buccal shelf to get to where it is. Now what's interesting, Guy gave us a really good plan there, because when you reflect the flap over a 3rd molar, you look where the bleeding points come up. And then you connect the bleeding points and you remove that bone, which is generally very thick, take it out, and you remove the top of the lesion. And so therefore you can work directly down into it. And if you have to expand out, you can once you're inside. So I'm trying to show people, and this was for dentists, how to find that spot and then take things out and clean them. Afterwards, I told Marty that I was going to go ahead and show this. He says, would you like an x-ray afterwards? I said, you want radiation? He says, if it's going to teach people what to do, yeah, I do. And this is where the nerve is. And down here is the mental foramen, right here. There's one there and one there. Many times I'll see people with root canals in these teeth because somebody took a wrong x-ray, making that look like it was an abscess. So it's something that I try to teach dentists, that very rarely do these teeth abscess out. You better make sure and do at least a cold test on it to see if it's alive or dead. So I can't tell you how many times I have people come in and tell me, they told me I need a root canal. I said, okay, what's wrong with it? I don't know. I said, well, why did they say you needed a root canal? Did they put an electric impulse through it? Did they put a cold to it? No, they just said there's a funny thing at the bottom on the x-ray, so I need a root canal. I don't understand that. So what happens, this is just a progression of going in and cleaning things out, just showing the relationship of the teeth and their location. This is bone, artificial bone at that time I was using. Now I actually use cadaver bone because the artificial bone didn't integrate. The cadaver bone that we're doing, I've sent to a lab, dental DNA, to see what they can find in it. Dr. Huggins is against cadaver bone because he says there's a disease in it and it's been processed very well. So I sent him my supply, and that was a month ago. I'm still waiting to hear what they found. So anyway, that's placed in, mixed with the patient's bone, and then we suture things up. When I get done with an extraction or anything, I suture it tight. I want that thing closed. I don't want it open, because when you take the sutures out, the sides will pop up like this, and then it heals from the inside out, like a volcano erupting. So that will give us a good extraction site and cleaning site. And that site today, you could put an implant in. We'll talk a little bit about implants and what not to do. I also use a lot of Sonum products. I have spoken for pleomorphic Sonum, and I use the Arde, Neg, Nef, PEF, and Tramiel with it. It's very usable, it's friendly with other products, and helps people heal very, very well. Sometimes I'll replace knot with muke for better circulation, and if I need things for the sinus, I'll use Quint. Case 2, diagnostic profiling of 1 of 8 patients that I did for my dissertation. Accurate detection of bone lesions and osteolytic abnormalities using the Cavitat ultrasonic imaging machine, a clinical study utilizing photo affinity labeling and histological assessment. That's a mouthful, isn't it? When you do a dissertation, you got to make it sound important. So anyway, this is a Cavitat of 1 patient. You can see that this is not very healthy, especially compared to that. That's the upper right third molar. Back here is the upper left third molar, lower left third molar, and then the lower right. And this over here is the second. Doesn't look very good. So here it is. Whoops, let's go back one. I thought I was going to do something else. Come on, guys. Okay. This over here is the root canal. So we get a histological report, which you can't read, so what we do is blow it up. Osteoporotic bone with ischemic bone damage, consistent with regional ischemic osteoporosis, a variation of a Nico lesion. Then we go ahead and we're going to look at what area. We got tooth number 31, the lower right. This tooth was a dead tooth. The intervascular clots here might indicate hypercoagulation site or state of the patient. What I think is happening here, and I had proposed for a dissertation, a PhD dissertation, was nanobacterium grow in this area and cause heart disease and the forming of plaque in your arteries and veins. And I couldn't raise $1 million to do it, plus you're looking at people who are teenagers and early 20s getting their teeth taken out, and it's not uncommon to hear 40, 50 years later people dying of heart attacks. And nanobacterium go very, very slow and clog everything up. So unfortunately, I couldn't raise $1 million to do that study. But ALT shows the site with the different toxicity levels, and anything that's a 5 is pretty bad. And you can see the phosphorylase kinase and all the different enzymes that take place to do your Krebs cycle and how it breaks down. And so we went ahead on 32, again, another Nico lesion, subacute osteomyelitis, right third molar area. And here's the affinity test on that, ALT test on it, very, very toxic. So out of 8 patients, 256 sites, we had 63 that called for surgery, 25%. When they submitted the machine, the Cavitat, to the FDA, it was approved as the top diagnostic level you could get because they had a second group that we didn't know about. They were bisphosphonate patients, Fosomex, Sally Field peoples being fed this stuff. They should be out in the field with it. But the whole thing is they had a 95% Nico lesion rate or ischemic rates. We had 25%. 3 days after that, the committee was changed. The ADA came in and had different people put on that committee and stripped the certification of the machine. So the FDA, I can't tell you what I think of them. I use different words. You can think of things that start with F, a D, and an A. So I'll let you imagine. But they're, what?
Fraud and deception.
Fraud and deception agency. That's much nicer than I would have said. But anyway, fact of the matter was, you had something that actually worked, and they just destroyed it. Occurrence rate, these are just the third molars, second molars, and everything else. I wish that I had now, with the knowledge that I have, to split it out to meridians instead of just teeth, because I think we'd have seen a very, very high level of breast cancer and prostate cancer and uterine cancer correlate to this. What we did find in these samples was we had 6 of those samples came back with viable bone, but their ALT was almost straight 5s. One of them had a 4 in it. And what that meant was that this says that it was really good bone. But when we went back to my notes, it was all soup. The body walls this off with solid bone to try to prevent it from getting in. And so we looked at extractions. Past extraction sites had toxicity of 73%, root canals 52%, and a vital tooth 49%. So putting this all together, DNA, dental DNA, which Hal Huggins owns, Christopher Shade is director, Robert Wheeler is the lab manager. And what they did was we came out, this was a cavitation. And in this, we had 39 different organisms. Now, you probably will know more about these things than I do. Actinobacteria baumannii is a very interesting bacteria that 10% of our patients in hospitals are dying from today because it attacks the lungs and destroys them. And there's no antibiotic that they say will take care of it. E. coli is another notable one. And so you can go through all these things and just wonder how they got there. But this is not uncommon for me to find anywhere from 25 to 48 different organisms in these past extraction sites. Actinobacteria, I just said. Actinomyces israeli is a normal colonizer, vagina, colon, mouth, responsible for vaginal cancer. Enterobacteria agglomeranis is responsible for various infections throughout the body, endocarditis. Holistic dentists claim that Leptotrichia Margolis is the dental granulomas from root canal therapies, and is very toxic throughout the whole body. So we're getting into the final stretch here, so I like people to get back into understanding that being in shape really counts. Helps prevent disease. So you just have to know how to use the equipment, right? Can you hear this? Well, sorry, I don't know what happened to that corner there, but, oh no, we're not going to see you again. Okay, so this goes with the top 20 DNA samples out of 90 different patients. These occurred 96% of the time, 94, 94, 89. So you can go through there and take your pick of organisms. And unfortunately, I am not a bacteriologist, so I can't really tell you that. But I think that dental DNA can isolate many different organisms. Unfortunately, with the method that they use, they have restrictions on heat and clarification of different organisms. So when I did a lecture a few weeks ago on Lyme disease, they do their Lyme disease through a urine test, not through the mouth test. They know it's there, but the cost of isolating it is prohibitive for them to do in an oral test. I talked about Mike earlier, that he had the brain tumor of the head and the lung. I forgot to mention, 3 months later, before he had his stroke, he went in and had a CAT scan. After we cleaned up his mouth, the brain tumor was gone. The heart tumor or the lung tumor that filled up the entire lung was about this big. So just by doing the dental revision, along with everything else that he did, you just can't do the dental, you got to do the support, nutritional support. But it was amazing to see how he reacted and how well he did. This goes back to some of our readings. If you ever read the book by Dr. Martin Fisher, Death and Dentistry, you'll get the connection between Billings, Rosnow, and Price and some of the earlier people who did all those experiments on rabbits. You know, I think they sacrificed something like 60,000 rabbits, where they took a tooth from a human being who had arthritis and put it into the rabbit, and 200 rabbits wound up with arthritis. He had a young man that he did a root canal on, and he died 2 weeks later. He took that tooth. He died of endocarditis. They put it in 200 rabbits, died of endocarditis. The major problem with that and his drive to understand root canals was that 16-year-old was his son. So he realized he killed his son by doing a root canal. So DNA testing gives us direct evidence between organisms found in cancerous tissues, arthritic sites, and other unexplained diseases from the patient's mouth. They were able, through their testing back in the 1920s and 30s, they were so meticulous that they were able to discover the organisms in different places. And because people weren't as meticulous as they were, Charles Mayo was part of that group, they could never repeat the incidences. And this is the other 10% that I had. But we came up with 85 different organisms. So which organ affects which organs? And so I went through and I listed the heart, I listed nerves, I went through with lungs and kidneys, and then porphyrin and red blood cells. And so oral cancer, liver, spleen. Now the reason I'm not trying to say these words is I can't say half of them, and I don't want to try to butcher them in front of you. But you can see what happens with cancer-associated bacteria. You'll find the human papilloma virus in the mouth all the time, and look at what it affects. We have myoplasms, many types of cancers, gallbladder. So if you look, all these organisms are found there. Right now in the DNA testing, we're trying to figure out what's the best way to identify them, because it is sensitive to heat and other things. And when we did it on agar dishes, we never could come up with this. Dr. Nepper, a German oncologist, stated that dental infections, especially inflammation of the bone around root canals, is a leading cause of cancer. Robert Dowling, North Carolina, I don't know if you've read his book, Am I Dead or Do I Just Feel This Way? Fred Hughes is the writer, the author of the book, and I got done reading the book. I was so impressed with the book, I called him, and he was with a patient. And he called me back, and it was really kind of funny, because I don't look at myself as special in any way, shape, or form. And this guy's sitting there all excited talking to me. I'm all excited talking to him. And they send me a lot of patients in Arizona and from surrounding states. They have really, if you haven't read the book, Am I Dead or Do I Just Feel This Way, please do, because he does thermal imaging, and that's one thing I'm going to add in my next lecture, thermal imaging, showing that a woman who had breast cancer, right up here is a hot spot, and you can see it just going straight down the neck. And it's sad. It's sad. But you can get those things out of there, and you just have to talk to patients. I had an endodontist in town. Dr. Shelton sent her over to me. She canceled the appointment because her endodontist said, "Don't go to him. He's going to pull your root canals out. And you know they're good teeth. They're only dead. And so will you be." So anyhow, I listed a few other different things, different diseases that Hal Huggins had suggested that people read, because Hal does own the DNA testing lab, and he thinks that we're going to find a lot more when it comes to carcinogenesis. The sustained activation of transcription factor, nuclear factor KB, by metal-activated signaling pathways can lead to chronic inflammation process and related diseases. The chronic inflammation, I think, is the beginning stage of cancer, and we see a lot of chronic disease in the mouth. Look in your patient's mouth. It doesn't take a lot to see if there's metal in there, if there's inflammation, if their gums are purple and they look like crap. They are. But if you go through and you do all your cancer treatment and you don't clean up the mouth, I think that you're missing the boat, because that's got to be done. Many of the young doctors I see in the area don't send them over because they say they only have enough money to do one treatment. They can't do both. So do you put the Band-Aid on it, or do you let it bleed? Let the patient go and decide what they need to do. And so something that's been brought to my attention by a number of doctors are bacterial biofilms. And it's something that we need to look at, especially if we're going to be treating patients and looking at different type of antibiotics or antifungals to be able to break down that biofilm, because it might be the biofilm is the glue that's causing the bacterium, viruses, and protozoans to do their dirty work. And biofilms are formed by microorganisms growing on surfaces. Titanium implants. At the bottom here in dentistry, I've removed dozens and dozens of titanium implants, and every single time, without exception, there's like a rust or a black surface on there that's an oxidative surface. And they're a lot easier to take out than the zirconium implants. I've removed 3 of these things, and they were hell. It took hours to take one out because it totally integrates into the bone. But the patient's immune system has to be able to tolerate either one. If I have a Lyme disease patient that comes in, we get them cleared up, they're doing great, and they come to me and say, I want to put an implant in there, I say, good luck finding somebody that will do it. Says, well, you do zirconium implants. I said, not to people who have had Lyme disease, because I have to sleep at night. Lyme disease, I don't know if you ever can cure it, but if you can keep your immune system up to fight it off, it's the same thing. You don't want to load their system. I have had some cancer patients that once the cancer was under control and stuff, we've reluctantly placed it in because I knew if I didn't put that in, they were going to go with titanium. So, you know, we're still, the jury's still out on that. But, you know, you get some of these people that seem to have more money than sense, and they go ahead and think that they are going to live through everything. So, Fry Laboratories in Scottsdale, I don't know if any of you know Stephen Fry. Amazing, amazing work that he's done. He does a lot of work. He thinks that biofilms may change and induce conditions where tooth decay, gingivitis, and other oral problems may arise. Where dental health is concerned, it's synonymous with biofilms. We think this is also in the rest of the body. And I have his thing there. I've worked with Jeremy Ellis. We're looking at profiles and things like that for their stuff. They can test 1,000 different organisms in 48 hours. They have a machine. I was in their lab, and I'm just amazed at the technology and money that they've put into this thing. You'd think he was a research lab. He has to pay for every piece of equipment like I've had to in my office. So, but they're amazing, and I'd take a look. If you can't find something, give them a call and see if there's something that they can help you with on drawing blood or taking tissue samples and sending them out, and they'll DNA it. Clinical connections. Take a look at the tooth charts that we've provided you, or I've provided you, and know what they're connected, and see if there's something wrong with teeth and the cancer that the patient has. Dr. Mike had recommended that I be asked to speak, and I want to thank Dr. Gerber for that. I'm sorry I'm not going to meet Dr. Ron and his circumstances. I certainly understand that. Last weekend, my mother's headstone was uncovered in Chicago, so I was doing that. So I completely understand, and give a lot of kudos to his family who's here and those that couldn't be here. And so to end up the day, I just wanted you to know that I'm going to vote for the American. Told you I'd get done in time.
Fantastic.
Thank you.
Excellent. You saved for some questions, right?
Oh, what's,
Can we have lights up, house lights, please? We're going to have,
which website? Which website? Oh, okay. Mine is My Dentist. I'm in Arizona, so it's az.com. My cell number is 602-363-9584. Text me. It's a lot easier. Take my word for it. It's a lot easier than that. My wife and I are raising our 19-month-old grandson, and at 60, I'm a new parent. Unfortunately, I didn't have the fun to make the kid, but, you know, what can you say? Okay, I guess we have time for a few questions.
We up? Oh, okay, good.
thank you.
Good. Mike Bowerschmidt, Fort Lauderdale. Thank you for your presentation. It was very enlightening. I particularly liked the Jack Webb sequence. But if you know the root canals are bad and the implants are bad and we got to chew, we got to be able to eat, what do you do for people with multiple root canals?
I take the root canals out. Then I can make removable partial dentures. What we do is I use a Clifford test, and we find out what materials there are. I muscle test everything, and I put something in there called oral systemic balance, or OSB. OSB is a device that was developed by Fran Robeson out of Tacoma, Washington. And what it does is it adds structure to the device and lifts the back of the tongue up and brings it out. Yesterday I was talking with a gentleman who, there's a Chinese acupuncturist. He doesn't speak any English. He does a lot of his acupuncture in the tongue on the bottom side, saying there are 42 different meridians in the tongue. And what's interesting is when I make a device, which of course I'm not wearing right now, but I have here, there's just little tiny contours on the inside of this thing that lifts my tongue in a particular way, and it increases my oxygen by 2 points on an OS2 meter, just by wearing a device. So I build that into a removable partial for those patients. Not everybody likes the idea, I'll be honest with you. I have an older sister. She had to have 3 root canals removed. I did 1. It took her 9 years to get the other 2 out because 1 was right here in the front. But it's health or it's no health, and that's what the difference is.
And one other quick follow-up question.
Please.
I noticed there was some, you don't agree always with everybody with IAOMT, which is great. When short of sending all my patients from Fort Lauderdale to Arizona, are there 1 or 2 questions that you would suggest I ask my referral dentist to see if they really are, you know, up to par?
Well, what I would do is I would ask them, 1, what type of anesthetic they use, make sure there's no epinephrine. 2, do they use any metals in their prosthesis or in their restorations? You don't want any metals. We have zirconium oxide today that can be made for crowns and everything else. There's no need for that. There are certain instances, like I had a patient come in, we don't have an implant to put down here for a denture. So the attachments to the titanium are made out of zirconium. But the screw is always going to be in metal because the zirconium oxide is not strong enough. The other questions I'd ask if they do root canals. Because if they're doing root canals, forget it. There is no safe root canal. I can't explain it any other way. So I would question that. And then I'd question their surgical technique. I've taught a few hundred dentists how to pull teeth, and unfortunately, even people that have come to my office that I've shown them what we're doing don't always get it right. Heck, I don't always get it right. I'm human. And, you know, the thing is that you take a look at it. If a patient comes to my office and we do surgery, they come back having trouble. I don't charge for follow-up surgeries, but I do charge a lot when it comes to the first ones. Most of the time, we don't have to do anything else other than that. But, you know, it's, do they follow up? Do they take care of themselves? The nutritional aspects especially. But I hope I answered your questions on especially the anesthetic, the metals, and what they do. Do they do root canals? Because I'd be scared to death of having another root canal in my mouth. I know what it did to me.
Thank you.
You're welcome.
Jim Novak from San Diego. I just want to clarify, you're advocating in anybody who has cancer that they get any and all root canals removed, or just ones that are on the meridian that corresponds to their...
Any and all root canals.
Even if they're asymptomatic?
Yes.
Okay.
That's, if I can't be any clearer, a root canal, okay? If you had a, let's see, what's the appendix, and that's inflamed and everything else, do you leave it in or do you take it out? If it's going to burst or whatever. Every root canal is a dead organ. How many dead organs can your body support, especially if you got cancer? And showing you just the partial list that we know of. Fry Laboratories is looking at the possibility of doing a dental thing too. And they're going to expand it out a few hundred more organisms that they know are carcinogenic and see if those are present also.
Do you think you're going to get an altered thermogram on any root canal that's there so we could have something to convince the patient?
Well, send them out. I'll talk to them. But shorter than a plane flight. Thermal imaging shows it very, very clearly. I was talking to Bill. Bill was telling me about a lady that had breast cancer, and you could just see the red going straight down. And I think what I'll do is I'll add that because Bruce Shelton has the thermal imaging in his office, and we've done the revision, taken everything out, and 9 months later gone back and done it and seen the difference between the two.
Very good.
So
thank you.
you're welcome. Good questions, though, because most people are very hesitant to take a lot of teeth out because, you know, you got to save your teeth. Maybe you'll lose a breast or two or, you know, something else, but I'd rather lose a tooth than a breast, personally.
Tom Kavish, Ann Arbor. Would you comment on the Topaz test and ceramic implants?
Okay, Topaz test is no longer available to my knowledge because the company went out. Topaz was a chairside test that you take a paper point, put it next to it, to the tooth in question, then put it in a meter and it showed the exact same thing as the AL test and show how toxic it was. That was bought out by the endodontic company, so it's no longer there. It was very accurate. It was not FDA approved for perio, or one of the other things, and that's how they were able to get it off the market. I do place ceramic implants. The conditions have to be right. And knock on wood, since I had a number of failures, I found out my technique that I was taught wasn't good, so I went back to school again, and now the last 25 or 30 that I've placed are just fine. But you got to have a healthy patient to do it. And it's all technique sensitive. But the zirconium oxide has been shown by ELISA testing in Europe that the bone integration is complete, it's direct, and you don't have the oxidation layer that you do with titanium. So if the patient's healthy and wants to do that and they have the proper bone structure and everything else, yeah, you can do that.
A final point, when the necrosis gets down to the vascular level, neurological level, I mean, I don't understand what you can do at that point.
When you go down and you open up, many times what I'll find is I'll find the neurovascular bundle right there and the decay is around it. You're very careful. You remove the bone out to the side and get a spoon or something in there, and sometimes I've actually lifted the neurovascular bundle and cleaned underneath. That takes a lot of huevos to do that.
I've used IV phosphatidylcholine for myelin restoration, like in shingles.
Yes.
Because I noticed you had that on one of your slides.
Yes.
Okay.
And that the phosphatidylcholine is something good to place in there. I do homeopathy with it. I've been happy, but that's a great
Michael,
step.
great presentation.
Thank you.
Very much. Been working with a biologic dentist in Tulsa, Oklahoma for at least 15 years. And
Tom?
yeah, Tom Colpitz, you know him.
Yeah, I know Tom very well.
Yeah.
Tom was one of my instructors.
What you were alluding to with regards to the thermogram, with the breast thermography, most of the time the collimation's here. Since they open it up to the nose, and I'm sending them down to, let's see, Gary down at Apothecure, Texas Functional Medicine Institute. And I got to tell you, there's a significant number of females with breast cancer that I've seen in my practice that they've had the inflammatory lymphatic drainage zones that came down to the breast. So I wanted to reiterate that or confirm what you were saying, that I see that in my practice more often than not. Additionally, one other thing that I wanted to bring up was Lyme's disease patients. Those individuals that you clear, you get stable, and then they remanifest again, but they haven't been rebitten. Virtually every one of those patients that I've seen in my practice had cavitational osteitis. And so whenever we sent them and got them cleaned out, then we were able to clear them again. So it's one of those things that you cannot overlook, in my opinion.
I feel like I should hand the man a $100 bill. Which is kind of funny. When I was lecturing, I met Thomas Rao for the first time. I was lecturing in Glendale, Arizona. Some person there turned around and looked at me and then looked at Tom and said, "Dr. Rao, do you agree with what Dr. Margolis just said?" Now, I'd never met the man. I never saw a picture of him. And he said, yes. So what I did was I took a $20 bill and handed it to somebody in the front row and said, pass that back to the gentleman in the back. Tom's never given me that $20 back. But I've lectured with him in Europe and other places, and it's just been great. So
Thank
Thank
you,
you.
Dr. Margolis. Thank you.
I was gonna